Okay. Just talking with you, Paula, before we started this film, I was quite interested in your take on people having regular smear tests and mammograms, etc., and that with ovarian cancer it's not something that is tested or picked up on. And correct me if I'm wrong, but I've been led to believe that a simple blood test, which could be done at that time, does pick up ovarian cancer. Do you think this is something that should be automatic every 3 years for certain women?
I do. Apparently, it's a CA125 blood test, and your markers in a lady that's ovaries are perfect is below 35.
Right.
Anything above 35, they have to look at. Mine, like I say, was over 5,000. And I think that, like I said, originally when I used to have my smear, well, I've always had my smears regular. So you think the ladies' areas,
yes, I think everybody
fine.
does that. Yes, I did.
And so it's such a shock to be told you've got ovarian cancer, because you think, well,
why didn't they find it?
Yeah, but also you think, well, this has got to be since my last smear.
Yes.
Basically, because you think that
would have picked it. Yes.
And it isn't, and it doesn't detect the ovaries or womb cancer. And I know the ovarian cancer can be detected by, like we say, a simple blood test, a CA125. I don't know about the womb, what they could do for that, but again, that's another frightening aspect, to think that a lot of ladies will think a smear will detect it and it won't. So
it's something that possibly could be looked in. It could be whether it's a cost-effective thing, I would imagine, taking blood test.
You know, you only have a smear approximately every 3 years anyway.
Yeah.
And I know it's a cost-effective thing, which we can all appreciate, but long-term, like
they're
looking
saving
at just
your
looking
treatment,
at all the money that's been spent on my treatment, one person's treatment.
Yes.
And I don't know how much a blood test would be, but relatively pennies compared to the treatment I've had.
Yes.
And all these ladies that will have to have this treatment,
if it was picked up
I bet
earlier,
it'll be balanced out easily, the costs.
I agree with you there.
Yeah.
You were saying to me, obviously, you've been very fortunate with your having a strong family and friends that have supported you. I always think it's far harder if you're someone on your own. What would you suggest that is the best thing to do if you find yourself diagnosed with something like that, and you really are perhaps someone who's on their own or has very few friends? What would be your suggestion to do?
I think the first point of call would be where you've been diagnosed, your team, see if there's anything they could offer, because like I said, the team that I've got, the gynae team, have got a lady, well, there's two actually, there's Louise Boltar and Nafisa Patel, that are always at the end of the telephone,
which is brilliant,
and that is amazing, and that helps so much, I think, with your diagnosis, because you know there's somebody always there supporting you that's got the correct information that you want. If anything you're bothered about, you can't get hold of the doctors, etc. They work with them, and if they know that your problems and what you're worried about, it's wonderful, because they go and have a word and then they get back to you. But if you've not got that, I think it's getting perhaps in touch with the Osborne building downstairs. There's an area that's got all different pamphlets, leaflets, etc., and asking them advice. And I know there's Macmillan, and I must admit I don't know a broad amount of people that you can get in touch with, because I've been very lucky that I've not had to get in touch with anybody. Yes. But I'm sure there's a lot of people and a lot of voluntary places out there.
I think a lot of voluntary,
you can get a lot of information from. And there's a lot of people as well that do have cancer or had cancer, etc., that they go there and they can mix and mingle it. And also
peer groups.
And these people that haven't got a lot of friends or much of a family, I think it's really good, because could become really good friends with people as well.
You can even get a positive out of a negative experience.
Right. Yes, definitely.
Yeah, I would have said that.
So I think that is a really point. Don't be on your own, and you need somebody to talk to, because you need other feedback, else otherwise you can be putting so many negatives into your brain, because nobody's there saying, no, wait a minute, there's this, and making you see the positive sides. And I think it's really important to get information if you are lonely, you've not got anyone to talk to. If you have got concerns and you are really, really worried, there's people out there that will help you.
Well, I agreed with what you were saying, that you are obviously very protective of your family. Yeah. I've got two youngsters who've been at uni, and I was desperately worried about telling my son down in Cornwall. And you become so overprotective of what you say or what you don't say, that although they're there for you, it's a big strain on you. So sometimes a complete outsider, I think from the psychological aspect, it's sometimes quite nice to have someone completely away from this close family that you can be totally honest with.
Yeah, that's right.
Because I wasn't totally honest with my two. I was very sort of, oh, I'm fine, you know. Yeah. And this is the way they expect you to be. And some days I wasn't fine. And it's a case of knowing someone to talk to then, isn't it?
Yes, it is.
Yes, I agree with you there. So what do you find you enjoy doing now? Are you back to your hairdressing?
I am. I'm not doing nowhere near as much as I was.
No, you put things in perspective now.
I have. It's turned my life around in the way that before I never stopped.
I was a workaholic as well.
Yes, and it makes you think there's more to life than
Definitely,
that.
you prioritise.
Yeah, I do socialise a lot anyway. But yeah, I'm having more me time now, more time for me, which before I never had that time. No. It's just put things into perspective a little bit more. Even though I feel 100%, I don't feel that I've had to slow down or what have you because of my health. I feel basically there's absolutely been nothing wrong with me.
No.
I feel like
so you've done it from choice of thinking this is a better way of living.
Definitely.
I mean, and obviously hairdressers are renowned for being somebody's best friend, so to speak. So you must have had a lot of people that were involved that knew about you.
Yes, I did. And I think that's one thing that's really helped me through everything. You know, I have got a lot of friends, and like my clients were my friends as well.
Yes, so, they would be.
Yeah,
yes, in the type of sphere you're in. But what always comes across with people who've gone through any journey is coming out the other side, you're not a different person, but you look at things differently. And I think even you have said that.
I think
things that were important maybe weren't so important before, and you do give more time to yourself.
Yeah, that's it. And I think that's a really important thing to mention, because I never gave myself, you know, it was always, I've got to do this, I've got to do my cleaning, I've got to do my dinner, I've got to do, you know, there was always a job to do in the house, you know, and whereas now sometimes I think, like this afternoon being here, I wouldn't have been doing that, I'd have perhaps been cleaning or
thinking
doing
I
dinner
should
and doing
be
this and doing that, because I'm always on the go, where now I think, it can wait.
Yeah, definitely, definitely. So have you got any holidays planned in the near future?
Yes, I have actually.
Excellent.
We go away a week today. For my husband's 50 a week on Saturday.
Oh, big 5-0.
Yeah, we're taking the children and Neil and myself, so the 6 of us are going to Lanzarote in a beautiful hotel.
How nice.
Yeah, having a week away.
Don't blame you. Yeah. Excellent. And again, looking positively, if we'd asked you that question probably a year, 18 months ago, you wouldn't have had any further thoughts about holidays or what you were doing.
Actually, it's only just over a year I was diagnosed, but to be truthful with you, I didn't even think I'd see Christmas, and now with originally the prognosis and it's the way it was relayed to me that made me think that.
I understand.
When I first found out, but it wasn't given to me in the best
possible light.
No. So basically, just look into the future, and I feel so well. I can't believe how well I feel. And like I said, I don't even feel that I've been ill.
That is amazing.
Yeah.
And it gives you something to really look forward to this holiday as well.
Yeah.
And also for your family to see you as they want to see you. Yeah. Do you find they treat you any differently, just out of interest? Are you?
Not really now.
No, you're back to normal, aren't you?
Yeah, see, you're all right.
I got all the sympathy for a little while, and then now I've got to be completely well and do everything.
Yeah. It was like, no, I'll do this, Mum, I'll do that. No, you do that. You know. Whereas now it's back to.
You're back to normal.
Yeah, I'm Mum, and Mum will do it.
Which is a good thing.
Yeah. And that's the way I want it.
I'm sure it is, yes. Yeah. I think that's the way everybody would like to look at it.
Yeah.
Well, it's been very nice talking to you and meeting you, and a very positive outlook for anyone who's listening to this film.
Yes, thank you very much.
And thank you for coming in.
To me. Thank you.
Thank you.